Hello friends, welcome back to New Travel. I am dietitian Rashmi Sethi. Hope you guys are doing extremely healthy and well. We all know that as we age, our brain changes, but Alzheimer's disease and related dementias are an inevitable part of our aging process. In fact, up to 40% of dementia cases may be prevented or can be delayed. So, to understand this a little better, we have with us Dr. Dhananjay Chavan. Namaskar, Dr. Dhananjay Chavan, and welcome to New Travel. Dr. Dhananjay Chavan is an MBBS and has pursued MD in psychiatry from BJ Medical College in Pune. He also has fellowship in geriatric mental health from King George Medical University, Lucknow. He works as a consultant with various hospitals in Pune and also conducts training programs in mental health for various family physicians. He has over 6 publications under him, and I'll definitely put up the names because they are a lot. So thank you for joining us, Dr. Dhananjay Chavan, and really a warm welcome to you.
Thank you.
To start, Dr. Chavan, what exactly is dementia? Because everyone is very, running behind that term and very scared of it. So what exactly it is?
Okay. So first of all, Rashmi ji, congratulations on selecting such an important topic. Also, congratulations on this channel, which is promoting health and well-being.
Thank you, sir.
And thank you for inviting me. Dementia is a silent epidemic. And if we are to give even 10% of the attention that we give to COVID, we will learn a lot and we will help humanity a lot.
Okay.
But because it is such a quiet and silent epidemic, we don't realize its seriousness. It is said that every person of our generation either will have dementia or will have to care for a person with dementia. So that is how important it is for each one of us. Now, what is dementia? It is a degenerative disorder. It is a brain disorder in which there are changes in the brain. And these changes come at a later age. That doesn't mean that every old person will get it. It is a disease of brain. It is not a disease of mind. So it has nothing to do with personality. It is a degenerative process. Dementia is an umbrella term,
Okay.
Which means like fever can be of various types. Typhoid fever, COVID fever, flu, this, that, malaria. Similarly, dementia is of various types, but the most common dementia is Alzheimer's.
Right.
2 other common dementias are vascular and Lewy body, but there are several others. Now, what happens in dementia?
Right.
I will tell you in very short.
Sure, sir.
There is a change in the cognitive status, cognitive ability of the person from his previous level. And that is why there is a deterioration, which interferes with the person's daily functioning. The elderly person then is unable to carry out acts of daily living, and it interferes with daily functioning, as well as there are changes in his behavior and in his psychological status.
Right. Right. So when we say that, as you have already mentioned, that means getting old is not always related to dementia, right?
Not at all. Not at all.
So all the old people who just, for small things, they worry about it. It is not always related.
No. So first we have to understand there are big misconceptions about old age. In old age, our mental abilities don't go down. If there is a significant change, significant and persistent change in a person's mental abilities, intellectual abilities, personality, or mood in old age, then it can indicate, not always, but often it can indicate onset of dementia. This is very important. Remember, in normal aging, one does not expect significant deterioration in one's mental abilities, one's mathematical, linguistic, memory, planning, judgment, all these abilities do not go down significantly in old age. But if they do go down and if there is a big change, then one must suspect dementia.
Sure, sure. So, as I understand that, or I have read, or I have seen, or seen in books, that there is no particular treatment if you are diagnosed with dementia. Then, what would be? Why is it important or useful if it is diagnosed at an early age?
Very important question, Rashmiji. There is no cure per se for the disease, but there are so many diseases in the world for which there is no cure.
Absolutely.
But this disease can be slowed. It can be prevented and it can be slowed after the onset also. So that is one reason why it can be diagnosed. It should be diagnosed early, because in early stages, the medicines that work to slow its progression, they are more useful in early stage. That is one. Second important reason is, in the early stage, if the dementia is caught, then the person can plan his own life after that, because afterwards he's going to lose the ability to plan anything. So in the early stage, the person can then plan how he wants to be treated in terminal stage, what he wants to do with his life. His family also can plan. Say somebody is staying away from the parents, then they have to plan, because they know that the patient is going to become more and more dependent on care from somebody else. So this planning is very important. It gives valuable time for planning at the early stages of the disease, which is a long time, because it's a very slow disease, very slowly progressive disease. And the last and very important reason is that if it is not diagnosed, then there is a lot of mental turmoil. इतना संताप होता है कि हमारे घर में बुजुर्ग ऐसा क्यों कर रहे हैं, इनको समझ में नहीं आ रहा है, ऐसा क्यों कर रहे हैं. तो ये जो घर में परिवार वाले जो होते हैं वो सेवा तो करना चाहते हैं, उनको वो बुजुर्गों के प्रति सम्मान भी है, लेकिन वो जो उनके मन में संताप रहता है, परेशानी रहती है, एक दुख रहता है, तो उनको पता चलता है ये डिजीज है, ये बीमारी है, तो फिर सेवा करना आसान होता है, फिर वो पर्सनली नहीं लेते.
राइट, मतलब until and unless we know what is the cause या रीजन क्या है या कुछ तो है, अगर एग्जैक्ट पता चल जाए कि क्या बीमारी है, उसके बाद घर वालों को भी सोचने का मौका मिलता है, या वो उस तरीके से अपने आप को भी मेंटली प्रिपेयर कर सकते हैं. बिकॉज एज वी से दैट इफ अ पर्सन इन द फैमिली इज नॉट वेल, द एंटायर फैमिली इज डिस्टर्ब. So absolutely, sir, I totally agree that it will give people a lot of time. Sir,
very well.
Yeah,
yes.
Sir, what are the signs or symptoms which we can see, या जिससे लोगों को पता चल जाएगा, और they can say कि हाँ, ये जो 5 symptoms है उसमें से मेरे को कुछ है, so maybe I can go and check myself for dementia.
Okay, so one important rule of thumb is, normally as we age, our mental abilities do not go down significantly. So if there is a significant change in your memory, in your planning, in your mathematical ability, in your linguistic ability, in your judgment, in your execution, in your coordination even, or in your personality, or in your mood. So if there is a persistent change which is significant and which interferes with functions that the person was used to perform earlier, then one must suspect that something probably is going wrong. Now, to give daily example is, because the most common dementia is Alzheimer's, in which the earliest symptom is recent memory loss. So this is very important to note, that remote memories, 10 साल पहले क्या हुआ, 20 साल, 40 साल, 50 साल पहले क्या हुआ, वो ठीक से याद रहता है. लेकिन आज क्या हुआ, सुबह क्या हुआ, कल क्या हुआ, ये भूल जाते हैं. तो कॉन्वर्सेशंस रिपीट करते हैं, वही सवाल बार बार पूछते हैं, चीज कहीं रख दी भूल जाते हैं, कहीं निकल गए रास्ता भूल जाते हैं. सो ये जो रोजमर्रा की डेली जो मेमोरीज है, उनको पहले असर होता है. सो रिसेंट मेमोरीज गेट अफेक्टेड फर्स्ट. दिस इज अ वेरी इंपॉर्टेंट डिस्टिंक्शन. पीपल डोंट रियलाइज. दे थिंक दैट 50-year-old बातें याद आ रही है, इसका मतलब मेमोरी स्ट्रांग है. नो, the old memories are the last to go. The first to go are the recent memories. So they keep repeating questions. They forget what happened in the morning, what happened yesterday, what was said on the phone. They forget appointments. They misplace things all the time. They lose things all the time. Those are the early symptoms, especially in Alzheimer's.
Right. So that means, people who are scared. कई बार ऐसे होता है ना सर, कि मैंने देखा है कि घर में ओल्ड लोग हैं, यार 2 दिन हो गए, 3 दिन हो गए, ये चीज भूल रहे हैं, तो सामने वाले ही कह देते हैं कि ये क्या हो रहा है, बार बार चीजें भूल रहे हैं, मे बी इज इट बिकॉज ऑफ हिज ओल्ड एज और इज देयर समथिंग एल्स. सो ये चीज मैंने बहुत बारी देखी है कि रादर घर में ही देखी है कि ये होता है कि क्या हो रहा है, मतलब बार बार भूल रहे हैं, कहीं ये एज के रिलेटेड है या कहीं और चीज है. सो एज यू राइटली मेंशन दैट इफ आई मीन कई बार मतलब मोस्ट ऑफ द टाइम्स यही होता है कि लोग ये सोचते हैं कि दूर पहले बहुत पुरानी बातें याद रहती है, मतलब बिल्कुल सही है, छोटी छोटी चीजें हम निग्लेक्ट कर देते हैं. सो दैट इज डेफिनेटली अ वेरी आई मीन गुड पॉइंट फॉर पीपल टू डिफरेंशिएट राइट बिटवीन आई मीन थिंग्स. जैसे आपने बोला कि ओल्ड एज में भूलना अलग चीज है, बट द फ्रीक्वेंसी ऑफ इट और हाउ their mathematical abilities are, तो ये सब चीजें इकट्ठे देखने बहुत जरूरी है. So looking at the condition and looking at how it progresses, how the person is affected or how the family as a whole is affected, it sounds really very horrific and terrible. So is there nothing we can absolutely do about it, sir?
No, so there is definitely good news, and I should have said this in the beginning itself, that now we know that this disease is not inevitable as we grow older.
Right.
In fact, in some countries, the percentage of people who get this terrible condition is going down.
Oh, that's
say in 20 years back, it was thought that after 85, 40%, 50% people are bound to get this. No, now in certain Scandinavian countries or even in other Western countries, the incidence of dementia is coming down because of better health facilities and awareness and healthy lifestyle. So there are things that one can do to prevent dementia, and this is very important for your young listeners, right, young viewers, to remember. And there is no age at which it is too late to start. You can start now. Your parents who are in 50s, 60s, 70s, they can also start now. So you can prevent it, and there are a few things that are known to be effective in preventing dementia.
So, sir, can you guide us with a few of the things? Because I have seen that nowadays, more than the older generation, the younger generation has become more forgetful. I mean, simple things if we ask, I mean, भूल गया या इतनी चीजें नहीं याद रहती. I had so many things on mind के ये चीज रह गई. So I personally feel that, the younger generation is becoming more forgetful than the older generation. But jokes apart, is there anything or any precautions or any exercises or any food, anything which we can do to delay the onset of dementia or prevent ourselves from it?
Okay. So first I will, you said something in humor, but there is truth to it. Young people can also become too forgetful if they are stressed, if there are too many distractions because of too much social media use, too much mobile use, and also because of depression. Okay. Depression also tends to affect concentration and attention, and therefore there is a perception of forgetfulness. So these are things that can happen to young people. But this serious condition where there is really inability to form new memories, that happens. So for dementia, the important factors are, the most evidence that scientists have gathered is physical activity. If you do a lot of physical activity, if you are active physically, then you will be able to prevent dementia. So being physically active, exercising regularly is perhaps the most important thing. The next thing is blood pressure, diabetes, and cholesterol. So these three things are very important. To control these three things will help you a lot in preventing dementia. You are a dietitian, so you must be teaching your viewers about what to do with diabetes, what to do with cholesterol. So these three are other risk factors that one can deal with and one can control so as to reduce dementia. Other risk factors are depression. If there is recurrent depression that is not treated, because often in India, we don't recognize depression, and therefore a person suffers recurrent episodes of depression, and that becomes then a risk factor for dementia. Another very important factor is alcohol and smoking.
Okay.
Alcohol in any quantity is a risk factor. So if you abstain from alcohol, you are protecting your brain. If you abstain from smoking, you are protecting your brain. There is one more thing that is relevant in India is along with smoking is air pollution.
Right.
If there is a lot of air pollution, then that also acts as a risk factor. So we must all promote good air. We must put pressure on policymakers to have better pollution controls, whether it's industrial pollution, whether it's vehicular pollution, or whether it's some other pollution.
Absolutely.
So that also is a risk factor. Hearing impairment is also a risk factor.
Okay.
Another risk factor which is very important, and because you are a dietitian, you will be addressing this, is obesity.
Right.
Obesity is a big risk factor. So obesity also, if you prevent obesity, then that will also help you in preventing dementia. So these are some of the risk factors. Then there are two risk factors which most people get it, but they don't implement. One is being active in social life. Doesn't mean that you have to arrange parties and marriages, but having friends, meeting them often. So having, taking part in charitable activity, social activity, that helps in prevention of dementia. And also continuing to learn throughout your life. I have got MD now, I have got fellowship, I don't learn anything, then that will not help. But if I keep learning all my life, then that will help me in preventing dementia. So these are the most important factors in preventing dementia. Again, I repeat, the most important one is being physically active. Keep doing something throughout the day. Don't be lazy, exercise, go out in the nature, and that will help you in reducing the risk of dementia. The other factors, as a dietitian, you will definitely address in your other programs. So these are the things that one can do.
Right. So what I understand is, along with the lifestyle changes, being social, and keeping your brain working is what is the what is the main thing what we can do to prevent or stay away from dementia. Because if we keep on challenging our brain, the brain has to work, and that is how it remains active, like we say about the other organs. So as you rightly mentioned, if we are not physically active, we are just not letting our body or our organs perform, and that is how the organs become lazy as we do, and they slowly and steadily keep on reducing their productivity. So that's absolutely, great, sir. Thank you for advising us. A last question which I want to ask, sir. I have seen a few people, wherein it becomes difficult for the family to make a decision whether the treatment should be done at home, whether there are good care taking places outside, whether there are hospitals. Even I am not aware whether in India there are places which take care of people with dementia or Alzheimer's, or if there are homes where we can where better care is taken, or then if family. I definitely understand that it is a decision to be taken by the family, as it is very personal. But are there such kind of facilities available?
Yes. So there are several such facilities. Some of them are run by some charitable institutes. There are also professional facilities. And these facilities are not as common in India as they are in other countries, but there are facilities. Now, the decision as to where to care for the senior, it is always better to care at home. But, and this is a big but,
Right.
Many people are not able to do it because of several constraints. At such time, when the family member is not able to cope at all with the patient, then the patient can be shifted to a dependent facility where they care for Alzheimer's patient. But in the beginning, at least, it is important and it is easier to care for the person at home. It is also important to divide the caregiving responsibilities. If the only one person is taking on the caregiving responsibilities, then it is too much for the person, and the caregiver stress is very often. Caregivers are known to get depressed, they are known to get burned out, so that shouldn't happen. Another thing that should be done is always find proper help. There are professional caregivers, you may have old maids or old household help. So if you are able to retain your household help for longer period, then they are sometimes the biggest help you can get in dementia patients. So there is no yes or no answer here. It is good to care for them at home. It is easier, but there are times when you have to move them to such facilities because you simply can't care for them at home.
Right, right. So that means there is nothing to be scared about dementia, because as you said that the good news is here that the cases or the number of people suffering from it is reducing. And of course, it is in our hands to, as we always say, to take care of ourselves. So being physically active, taking care of our body, doing health checkups regularly so that we know where we stand in terms of our sugar levels or our cholesterols or our hypertension, and also staying away from smoking, alcohol, and keeping our brain active through some way or the other. I mean, if we follow all these things, the numbers can be taken to zero in the coming years, definitely.
Zero will be too optimistic,
Right.
but definitely it will go down. It will go down. At one time, cancer was the most feared disease in the world.
Right.
And today we see so many cancer survivors because we got more and more information, the treatment became better and better. Now the cancer word at one time used to be such a terrifying word. It is not so terrifying anymore. With dementia also, with more and more research, with a better understanding and better preventive measures, I think we will be able to cope and reduce the impact of this silent epidemic, which as of today is affecting 50 lakh people in India. So it's estimated that 50 lakh patients of dementia exist in India as of today. So it's a huge epidemic. And as you say, we will be able to face it, definitely reduce its impact. And this, information like this goes a long way in making public, common people aware about the illness and also as to how to prevent it.
Right, right. So thank you so much, Dr. Chavan, for enlightening us, because it was, we know about dementia, but we a lot of times do not know what exactly it is, what are the symptoms and how to face it. Right. So thank you so much for giving us this information, and hope to see you soon with different topics on our channel.
Thank you very much. Thank you, Rashmi ji.